So many people might not know the difference between going through Medicare alone versus working with with a broker like yourself. What is your role in helping people enroll and choosing the right plan?
Well, I'm really glad you asked that question, because when you go into Medicare, as we've talked about, it's complicated. There's lots of moving parts. You need somebody that can help you. Those people who call the 800 numbers and to hear if it's the advertising, or they hear from a friend and they call up, they're going to get some information, but they're going to be speaking to an agent who's looking to enroll them. If you do enroll with them, then you're going to be dealing with an 800 number anytime you need some service. Where I come into play, and as a broker that specializes in Medicare, is it's really service from the very beginning all the way through when somebody owns a policy. I actually help people enroll in Medicare with the government, the Part A and B, on the Social Security website. It's ssa.gov, and it takes about 20 minutes to enroll. People have a couple of other options. They can call Social Security. Unfortunately, good luck with that. Normally, you're on hold an hour and it will cut you off. Not making this up. I make those phone calls. Or you can try to schedule a time to meet with your local Social Security office. That would be your other option, but that can also entail waiting and line, etc. The easiest, in my opinion, to enroll in Medicare is to do it online. As I said, at the Social Security website, it's ssa.gov. I walk people through it. I actually come to their house if they'd like, or we do it over the phone where I've got it pulled up in front of me and they pull it up in front of them, and we're on the phone. I kind of walk them through and get them enrolled. So that's the very beginning, because you first have to be enrolled in Medicare with the government before you can then move on to look at your Medicare Advantage or your Medicare supplement plans. Well, that's where I come in also. I do a tremendous amount of research to find the right plan for an individual. You have to understand, every single person is different. Even husbands and wives may have different doctors they go to, different medications they're on. So your Medicare coverage, your health insurance type coverage, is extremely personal, and it really matters who are your doctors. Do you travel a lot? Are you someone who's out of the area? What medications are you on? What do you have any particular conditions that might qualify you for more coverage? For example, there are plans out there that are called chronic special needs plans for people who may have a heart issue or kidney issues or things like that. So I do a lot of fact finding, a lot of needs-based research, analysis to find out what coverage, what somebody needs. Everybody's different. Some people like Medicare supplements. There's several reasons why, and that's something we'll touch on in a later time. Some people like a Medicare Advantage plans because of the cost advantages, and it's things that they're used to. So it's really a matter of doing a lot of fact finding. And then what I do is I have a platform that literally can pull up every Medicare Advantage plan and Medicare supplement plan available in the area. So once I know what somebody's looking for, we can pull those up and make comparisons. Once again, I often do these face-to-face, and I often do them over the phone where I've emailed the comparisons. And, they can have 3 comparisons at one time, and we kind of look across and literally work our way through those. Jonathan, I will tell you, it takes close to an hour. Don't want to scare anybody with that, but there's so much to talk about. Want to make sure we got the right medications. Want to make sure that the doctors are in network. So we try to do the review for that. My real goal is to find a custom fit for my clients, but it doesn't happen just by boom. You've really got to do the research. You got to do the work. You've got to do the education. And that's how you come out with the right plan for the right person.
Thanks for watching part 2 of our Medicare series. In part 3 of our Medicare series, we'll be answering who is eligible for Medicare. Don't miss it. Follow us for more Medicare insights.